Hi everyone, I am Jamarly Plato, and this is my oral report about the child and adolescent learner and learning principles from week 10 to week 12 topics.
So we are here now in our Unit 4 topics. It's all about the development of the learners at various stages. Our week 10 topic focuses on prenatal period. We must learn how we all begin and created. Each of us has its own purpose in life purpose. The prenatal development has 3 stages or period. First is the germinal period, from conception to 2 weeks. This development takes place in the first 2 weeks after conception. It includes the creation of the zygote, continued cell division, and the attachment of the zygote to the uterine wall. The second one is the embryonic period. The prenatal development occurs 2 to 8 weeks. The zygote will become embryo organogenesis, which is the process of organ formation during the first 2 months of prenatal. There is 3 layers of the cells. First is the endoderm, inner layer of the cell. It becomes the digestive and respiratory system. The second is ectoderm, the outermost layer of the cell, becomes the nervous, sensory receptors, and skin parts. The last one is mesoderm, the middle layer. It develops into a circulatory, skeletal, muscular, excretory, and reproductive system. As the 3 layers of the embryo form, the support systems for the embryo develop rapidly. The 3 life support systems. First is the placenta, a life-sustaining system composed of a disc-shaped group of tissue in which small blood vessels circulate, vessels derived from the mother and offspring. They entwine but do not join. Second is umbilical cord. Umbilical cord contains 2 arteries and 1 vein that connects the baby to the placenta. Last is the amnion. This is a bag that contains a clear fluid in which the developing embryo float. The last period is the fetal period. It lasts from about 2 months after conception until 9 months when the infant is born. Dramatic course and organ system mature to the point at which life can be sustained outside the womb. The teratology and hazards to prenatal development. Teratology is the field investigating the causes of congenital defects of birth, or teratogen is which causes birth defects. It comes from the Greek word tera, which means monster. These are the clusters of hazards to prenatal development. Number 1 is prescription and non-prescription drugs. For example, in prescription drugs is the antibiotics that can be harmful on the developing fetus. In non-prescription drugs is the diapios and paracetamol. That's why mothers should be observed on what they are taking. Number 2 is the psychoactive drugs. The example of this is the alcoholic drinks, heavy drinking, and the caffeinated coffees. Heavy drinking by the pregnant can result to the so-called fetal alcohol syndrome, or FAS. Third one is the environmental hazards. This includes the radiation, environmental pollutants, toxic waste, and prolonged exposure to the heat saunas and bathtubs. Early exposure can affect children's mental development. Number 4 is the maternal factors. Maternal nutrition during pregnancy may result to inadequate growth of the fetus. Number 5 is the paternal factors. These paternal factors can affect prenatal development, include exposure to lead, direct radiation, and petrochemicals. At the end of this topic, we should remember that human life begins at conception. Our second topic from week 11 is about physical development of infants and toddlers. The period that comes after prenatal stage is infancy, which in turn followed by toddlerhood. There are 2 patterns in this development, the cephalocaudal and proximodistal patterns. Cephalocaudal trend is the postnatal growth from conception to 5 months, when the head grows more than the body. This growth of the cephalocaudal trend that applies to the development of the fetus is also relevant in the first few months after birth. Infants learn to use their upper limbs before they learn to use their lower limbs. The same pattern can be seen in the head area because the top of the head, the eyes, and the brain grow at a faster rate than the lower parts of the body, such as the jaw. The proximodistal trend is the prenatal growth from 5 months to birth when the fetus grows from the inside of the body outwards. This is also true in the first few months after birth, as demonstrated, followed by the hands and fingers, when the approximate distal trend in more development refers to from the center of the body to the development of motor skills, body extending outward. This development includes the height and weight. It's normal for newborn babies to drop 5 to 10% of their body weight within a couple of weeks of birth. This is due to the baby's adjustment to neonatal feeding. Once they adjust to sucking, swallowing, and digesting, they grow rapidly. The second one is the brain development. Among the most dramatic changes in the brain in the first 2 years of life are the spreading connections of dendrites to each other. The myelination or myelinization is a process in which the axons are covered and insulted by layers of fat cells, begins prenatal and continues after birth. This process increases the speed at which information travels through the nervous system. The last one is the motor development. Along this aspect of motor development, infants and toddlers begin reflexes to gross motor skills and fine motor skills. Reflexes. The newborn have some basic reflexes which are automatic and serve as survival mechanisms before they have the opportunity to learn. Many reflexes which are present at birth will generally subside within a few months as the baby grows and matures. There are many different reflexes. Some of the most common reflexes that babies have are sucking reflex. This is initiated when something touches the roof of an infant's mouth. Second is rooting reflex. The baby responds by turning his or her head in direction of the touch and opening their mouth for feeding. Next is gripping reflex. Babies will grasp anything that is placed in their palm. Next is curling reflex. When the inner sole of a baby's foot is stroked, the infant responds by curing his or her toes. Next is the startle or moro reflex. Infants will respond to sudden sounds or movements by throwing their arms and legs out and throwing their heads back. Next is the gallant reflex. The baby will respond by curving his or her body toward the side which is being stroked. Next is the last one is tonic reflex. Whichever side the child's head is facing, the limbs on that side will straighten while the opposite limbs will curl. Next is the gross motor skills. The dramatic motor development is shown in babies unable to even lift their heads, to being able to grab things off the cabinet or to chase the ball and to walk away to their parents. Next is the fine motor skills. These are skills that involve a refined use of the small muscles controlling the hand, fingers, and thumb. The development of these skills allows one to be able to complete tasks such as writing, drawing, and botany. If there's a question in your mind like this, can newborns hear? Well, yes. Infant sensory thresholds are somewhat higher than those of adults, which means that stimulus must be louder to be heard by a newborn than by an adult. Can newborns differentiate odors? Well, yes. Can newborns feel pain? Do they respond to touch? Well, yes. They do feel pain and respond to touch. Can newborns distinguish the different tastes? Well, yes. Sensitivity to their taste might be present before the birth or before their birth. Our last topic to be conducted today is from the week 12, the cognitive development of infants and toddlers. Babies are not only growing physically during the first 2 years of life, but also cognitively. Every day, while they are interact with and learn about their environment, they are creating new connections and pathways between nerve cells, both within their brain and between their brains and bodies. However, cognitive changes and development is a little harder to determine as clearly. Object permanence. We all know that the term object permanence is used to describe a child's ability to know that objects continue to exist even though they can no longer be seen or heard. The concept of object permanence plays a significant role in the theory of cognitive development created by psychologist John Piaget. In the sensory motor stage of development, a period that lasts from birth to about age of 2, Piaget suggested that children understand the world through their motor abilities such as touch, vision, taste, and movement. During early infancy, babies are extremely egocentric. They have no concept that the world exists separate from their point of view and experience. To understand that objects continue to exist even when they are unseen, infants must first develop a mental representation of the object. Infants are also develop their language. Language development. Your child might achieve in language development between 3 months and 8 years. In 3 to 12 months, In this period, the baby will most likely coo and laugh, play with sounds, and begin to communicate with gestures like waving. Babbling is an important developmental stage during the first year. At this stage, though this speech doesn't mean anything, first words often start by around 12 months. In 12 to 18 months, at this age, children often say their first words with meaning. For example, when your child says "dada," your child is actually calling for dad. In the next few months, your child will keep adding more words to their vocabulary. In 18 months to 2 years, in your child's second year, their vocabulary has grown and they will start to put two words together into short sentences. Your child will understand much of what you say, and you can understand what your child says to you, most of the time. Childs can also learn and remember. Learning and remembering. Pavlov's classical condition and Skinner's operant conditioning have been proven to apply in infants. All of us experience infantile amnesia, the inability to recall events that happened when we were very young. Psychosexual theorist Sigmund Freud called it childhood amnesia. That not all the things that we can recall, but those memories will be shown to our conscious and subconscious mind. So finally, that is all of the summary of our topic from week 10 to week 12. Thank you guys for watching and have a great day.